Welcome to the Caregiver Relief Podcast. I'm your host, Diane Carbo, a registered nurse and a passionate advocate for family caregivers everywhere. If you're feeling overwhelmed, searching for solutions, or simply want to better support the aging loved one in your life, you're in the right place. And if you're a senior, this one is definitely for you. This episode is sponsored by myvitalvault.net, your all-in-one life organizer for aging adults and caregivers. It's designed to help you securely store your essential legal, medical, and emergency information in one easy-to-access place. Because when a crisis hits, being prepared can make all the difference. Join our Caregiver Relief community, a warm, welcoming space where you can connect with other caregivers, ask questions, share stories, and find support from people who truly understand. Visit community.caregiverrelief.com to join now, because caregiving is one of the hardest and most meaningful things you'll ever do, and no one should have to do it alone. And if this episode speaks to you, please take a moment to like, share, or comment. Every click helps us reach more caregivers who need encouragement, resources, and hope. Today's episode is about catching the small signs before the big problems show up. I'm joined by Ash Roy, the CEO and founder of SeniorLife.ai, a company that's redefining how we care for older adults using smart, compassionate technology. Ash brings a wonderful blend of personal experience, professional insight, and innovation. His journey began with a knee injury while descending Mount Kilimanjaro, and that gave him a first-hand glimpse into the struggles many seniors face with mobility and safety. Later, while leading a smart home company in Japan, Ash was asked to help develop a system to monitor older adults, an experience that would ultimately shape his mission. Now, it's important to recognize that Japan has been working on the challenges of aging for over 20 years. Nearly 30% of their population is over 65, making them one of the most aged societies in the world. In response, they have implemented national strategies that integrate technology, community-based care, and early intervention tools to support aging in place. While the U.S. is facing similar challenges, Japan is further along the curve, and their experience gives us glimpses into what's possible when we plan ahead. In this episode, Ash and I are going to explore how subtle changes in a senior's movement, memory, or behavior can be early indicators of bigger health risks. We'll talk about how caregivers and families can recognize these sounds and gently step in before a crisis occurs. And we will discuss how technology, when used wisely, can actually empower seniors to retain their independence while offering peace of mind to their loved ones. So if you've ever wondered how to support aging at home with confidence, this episode is for you. Ash, thank you so much for coming on this podcast today. It's exciting. I'm glad you took time out of your busy schedule to talk with us today.
Thank you. Good morning, Diane. And thank you so much for the introduction. We are excited. So if I can digress for a second. So all of us are going to age, right? Chronologically. Yes. So our mission is, can we slow down your biological age? Can you figure out early on, hey, this could be problems. If we can spot it early on, whether it's cognitive or mobility issues, and take care of it early on, then our biological age is going to slow down. So even at 70, you'll be playing tennis like you're 55 if you took care of it early on. So that's our big mission, age smarter. And everything else, the technology, the implementation, all that stuff that we're doing falls from that. We exist because we want people to age smarter, slow down their biological age.
I love that. Age smarter. I've never heard that term before, but I'm going to use it.
Feel free.
As a 72-year-old semi-retired nurse, I can tell you my body is broken. I have so many things wrong. Like, as I told you earlier, it's silly, but I tell people I used to pick up men for a living, and we literally did a lot of heavy lifting as nurses. And I have chronic pain, my neck, my lower back, my SI joints, my knees are shot. So I'm really excited about this tool because we all worry about two things: falling and developing dementia. And your tool helps us with that. So can you walk us through how Senior Life AI works, and how do your tools and sensors detect these early signs of cognitive or physical decline?
First of all, the only thing you need is your phone. That's it. You don't need anything else. And you take a video by yourself or in a clinical setting. Either way is fine. Or your dear or a caregiver, or even your spouse or family member just takes a video with his phone, right? And then the video gets uploaded. They upload the video to our server. We analyze it in our server in fractions of seconds, right? And if you send us a 20-second video upload, we will analyze it, the 600 frames in there, 30 frames per second. And then we will come back and tell you whether you have specifically what problem you have in your body that might lead to a risk of fall in the future, and how to fix it. That's the most important part. Even if you figure out what my problem is, what do I do about it, right? So we have a personalized recommendation that is also AI enabled, that takes into account your age, gender, BMI, medical history, and all of that stuff, and personalizes, these are the 4 things you need to do, right? And then you can come back and check 3 months later or a month later. So what happens is there are 2 situations where people use us. One is annual wellness visits or at home. And the second situation is when people are rehabilitating from an injury or an operation or a stroke or something.
I recently had a wellness visit, and what surprised me is they don't address my mobility, and they didn't give me a mini mental status exam. And the thing is, people don't understand that is a baseline that you should have after the age of 50. We should all have it on a regular basis, because if you need to have that know what your baseline is, and then determine the changes that happen over a period of time if you are developing dementia. So one of the things that I love about this is something that they can incorporate into their wellness visit.
Correct.
Correct?
Correct. Absolutely correct. So we actually, a very big concierge clinic in Napa Valley is working with us. And as you might know, Mayo Clinic, which is an investor, a shareholder in our company, they are very big, and we will come out with some more stuff in September. We will push it out to the annual wellness visit. A lot of companies are trying out our product. It has to be an annual wellness visit. And the key is it has to be extremely simple and doesn't disturb the workflow of physicians. You were in the you were on the other side, so you disturb. If you're a physician and you're introducing anything new to me, I don't want to do it, right? So that's the first thing we took care of. No change in workflow. It's absolutely integrated to your EMR, and also it's extremely simple, almost as simple as the patient himself or herself can use it. Right. So I think that's why you would see, and without prevention, we can't handle healthcare here in the US. We have to go after prevention.
Exactly. We actually have a public health crisis right now. We have more seniors than youth, as you do in Japan. You've been dealing with this a lot longer than we have, but we are totally unprepared. We have no one to provide care for our seniors, and it's very sad. And many of them are left to fend for themselves. And our Medicare reimbursement is so low that our doctors only get a 15-minute visit. They get reimbursed for a 15-minute visit. That's why you get in and you get out. But the wellness visit is 40 minutes. And I have to tell you, I was really disappointed because they didn't do the mini mental and they didn't do my mobility check on me, because, that those are the two big things that every senior wants addressed. They don't know it, but I do. And I'm telling you,
So what? So the
about.
problem, yeah. So the challenge for the physicians, if I can take from their side, is it takes time. It takes somebody skilled to do it.
Yes.
So what we have done in both in the cognitive side and mobility side is it's a 20-second video. You can do it, and then it gets analyzed and presented to the physician in a way that he can understand with all kinds of details. Hey, this person might have scoliosis, for example. So we have brought this in a platter to the physician so that he doesn't have to get outside of his workflow, and he can do it really quickly. And it's really cheap. There's no cost to it other than just making a video.
You're right. The wellness visit is a time when they have more time, but the physicians don't have time. They don't have the experience to do the mini mental. They don't know how to check for balance in a short period of time. I'd like to ask you if you have it on your website that there is a client, an individual can the assessment for free, and then they can take it into their physician. Is that correct?
Yes, that is correct. So there are two modes you can use our app. One is let's call it a caregiver, physician, staff, like a professional. The other mode is individual. If you're registering as a professional, then you can add your patients and so on. If you're registering as an individual, then there's no adding patients. You can just go in and you can take only one test, which is the TUG. That's for free. We made it for free. And once you take the test, you can type in your doctor's email address. The PDF will automatically be emailed to him.
That is wonderful.
It's all all details would be emailed to him, and of course to you as well. So you can take it either printed, or you can take it as a PDF, or you can come back to our app and it's completely interactive.
Yes. Now, one of the things I know people are going to be concerned about is privacy. So can you address that a little bit? Because I know that's a concern for many.
Very much. So we are HIPAA compliant, and we're also FDA certified, class 2, which means it's a software as a medical device that can be used for diagnosis. So there are 3 parts to privacy. One is your personal information, such as banking, etc. We don't collect any of that information. Number 2, we don't even require your name. You can just type in DC so that you understand who it is. But we do need an email to verify that you're a real person. Other than that, everything is, you don't need to enter any information. And it stays de-identified in our system. De-identified meaning our engineers don't have access by design. Nobody has access to the data other than you yourself.
Okay. Well, so that's comforting to know.
Yes. And the third part is you can decide to delete the video after you perform the test. You can just pack in, you just tap and say, delete my data. Your video data gets deleted, but your results stay.
Okay.
We have detailed results for your physician. And then in case of our provider and payer customers, they like to put the data in their system, so we don't have access to it anyway.
Ash, what advice do you have for a family caregiver or a person who's not providing care right now, but they notice small changes in their loved ones, either their mobility status or their cognitive status, but they're not sure how or when to step in?
Yeah, so excellent question. We were asked that question in Japan. By family caregiver, I assume you mean like a daughter or a son or a friend or somebody. So a good way to do this is if you feel the person is limping and that limping continues, or if the person's left shoulder is down and the shoulder is down for a while, right? For a week or 2, you just ask him, hey, can we take this quick video? And then you can do a quick check on the app and just completely anonymously. There is nothing you need to do. And if it comes back after an analysis that, hey, you have a medium risk, and these are the reasons you have a risk, at that point, either you go to a doctor or you do that test again in maybe a month later, we will give you personalized recommendations how to fix it.
Oh,
So
that's
yeah. So for example, let's say for sake of example, let's say the exercise recommendation is squat, right? To do squat.
good.
But
Uh-huh.
if we figure out, if you give us the information that you have eye problems or knee problems, our AI would automatically adjust to your conditions, to your BMI, to your height, to your weight, and many things, and change the recommendations, but the still same goal of fixing that problem. And so it's iterative. We tell you what the problem is, how bad or how serious the problem is, then we tell you what you need to do, and then you come back and check again.
Wow.
And you can share that.
How now here's the big one, the even bigger than the mobility is the dementia, the cognitive
Correct.
status.
Correct.
Can you walk us through what that might be like as well? Because I know many family members think that there might be something. And of course, seniors will say, there's nothing wrong with me. I'm fine.
Yes.
But they're repeating themselves over and over again. We live in many are in denial, and the families are fearful that if they say something that indicates they're concerned, they're going to be admonished by their demented senior. So can you tell us how that test works as well?
Yeah, before we go into it, I think the biggest thing that we realized is fear of shame. It's easier for
Yes.
the big difference between mobility and cognitive is mobility is okay. Yeah, I understand I got my knee injured, but I can fix it. You find you walk with a crutch, you can fix it most likely. So it's not as shameful as I forgot where I left my remote. Oh shoot, I found it in the fridge.
Yeah.
And so so people don't talk about it. They don't even talk about their close family members and so on. So I
Mhm.
think so the other problem with the cognitive side is if you get diagnosed, it's already too late because the only thing that's available at this point is mitigation. Alzheimer's costs $350 billion to the system. That's
Yes.
bigger than cancer
Yes.
and heart disease as two other groups, right? And the reason is you just live longer and you forget you're in a blissful state, probably. But your family members, become increasingly blissful because you don't know where you are. But your
Yes.
family members are going through this horrible, horrible experience. So we went after Alzheimer's first because Alzheimer's is about 70%, 75% of all dementia. The other
Yes.
two being vascular and Lewy body. So what happens in Alzheimer's is about 10 years before you're diagnosed Alzheimer's, your brain is still healthy. Your hippocampus is fine where the memory is, but
Uh-huh.
you start forgetting things. Your brain is still healthy. So your other parts of the brain is compensating for you. So your family members or anybody who's living with you, your spouse, whoever may notice it, but they may notice it from time to time, but they can't really tell if you have Alzheimer's or not because you're still healthy.
Yeah.
That state is called amnestic mild cognitive impairment, AMCI.
Okay.
We released a test that can effectively replace an MSE, and which is a 50-year-old test, right? Just with an iPad. Okay. And here's how it works. So just watch my face. Imagine this is an iPad, and you're asking me. Our test is asking us to follow things or unfollow a dot, and we're able to look at your gaze, and we're able to look at how late are you when I'm asking you to follow a dot, or how correct are you when you're asking you to follow a dot. Even if your mental state, even if you're totally healthy, look healthy, our software can now pick up 10 years before Alzheimer happens. What is the risk of AMCI? 100% of the people who have AD had AMCI.
That's
So
amazing. I want my listeners to know that Alzheimer's or any form of dementia that can occur, because there's 100 different kinds, but it can occur as early as 20 years before you get an official diagnosis.
Correct. In fact, CMS as well as CDC, CMS would ask you to do your fall risk checks, as you mentioned, in all your annual wellness visits after 65.
Yeah.
But CDC and CMS recommend that you check for your Alzheimer's, if there are any signs of it, at 50, starting at 50. So yes, it does happen 20 years before. And
Yes.
and then when it declines, if you look at the curve, the cognitive functions decline really sharply. So it's very hard to capture, very hard to do anything once it declines like this. After that, you're basically on $40,000 a year drug that's just keeping you alive.
Yes.
But if you do capture 10 years before it's diagnosed, physical therapy, change in diet, cognitive therapy, these three things can, in 70% of the times, it can at least delay it by 10 years.
Yes.
And in 30% of the times, it can cure it. This is proven. And so the whole question is, how can you accurately, correctly predict it 10 years before? We couldn't do it until now because the technology was not there for us to capture your eyes 60 times a second. If you're looking at it for 1 second, or let's say if you're looking at it for 10 seconds, I have 600 data points.
Wow.
And we didn't want to bring a solution to the market where you wear all of these things in the ophthalmologist. Today, you can do it at simple iPad.
And that's the key. One of the things I hear when I say it can happen 20 years earlier, and it's better to know earlier than later because you can make those important lifestyle changes to slow the process of the disease occurring. People are hesitant because they don't want to know. And I'm like, oh my gosh, you've got to get over that, because if you can make steps to eat right, exercise, even they tell me that doing something different every day creates new neural pathways. Walk backwards, take a different way home when you ride in the car, drive in the car, do things differently. Try to write with your left hand instead of is it a challenge? Yeah. But you're creating new neural pathways. So when people give me that argument that I don't want to know because I just don't want to know, I'm thinking, but yes, you can do little things every day that can make a difference in your health in the future and delay the decline of your body and your mind. It just gives you a better quality of life for a longer period of time. It just makes sense to me to know.
There are two issues there. One, you don't go to the wellness visit. 50% of the 64 million people that are seniors do not go to wellness visit in the US. And the second problem is I wouldn't want to know a lot of things that I'm a little afraid of unless it's absolutely private. Yeah. Not even my doctor. So that's what we're bringing. We're bringing it directly to you.
Yeah.
You do it. If you find there is a risk, maybe you found it or found there's a risk and you don't believe in it, so you do it twice, that's fine, go ahead. But once you're convinced, once your awareness is heightened, right? Or my patient's awareness is heightened, only then I'll start taking actions. So we're bringing it to your complete privacy. Figure it out for yourself. And you don't need any tool. You just need a phone or iPad or whatever. And we couldn't have done that even 2 years ago. The models were not there. The AI models today, what they do, sorry, I'm digressing a little bit, but a little nerd talk here.
It's okay.
So the way you can analyze your gaze, where you're looking at on the iPad, and the speed at which we can do that on our computers, because our money is our speed, right? How fast we can do the process. Otherwise, it's very expensive. That has gone 100-fold, meaning I'm able to do it 100 times faster than 2 years ago. So we're in great times today. We're in great times today.
Absolutely.
Yeah.
Now, there's still a challenge of introducing technology that will be met sometimes with resistance. It's the nature of the elderly. How can caregivers or family members present these tools in a way that empowers rather than alarms the senior?
Yeah, I think so. First of all, we've been asked that question so many times. I think our technology as it is just the same thing as phones. So everybody's used to the phone, right? We're not bringing anything, no sensors, nothing. I think the
Hmm.
first thing we need to address, which is the white elephant in the room, and you already actually talked about it, is privacy,
Yeah.
right? And how I want to know more about it, but I just don't want everybody else to know about it. And so that's something we have addressed by completely de-identifying and not even asking you for your data in the first place.
Okay.
Okay. The less you give, the less is our personalization. But
Right.
we can personalize a lot if you provide all the data in an anonymized way, meaning no first name, no last name.
Uh-huh.
Okay. And it could be your daughter's email. That's fine. And then you can delete the data after you get the results. But I think privacy is the biggest issue, and making people understand that you can do it completely privately and absolutely easily, just like your phone, basically, because everybody's used to an iPad and a phone. But having said that, we have found the biggest thing that people love about our product is that it's super easy to use. That we don't have training. It's built like an Apple system. There is
Uh-huh.
everything is if the thing is not absolutely intuitive to you from the very beginning, then we have made some mistakes. We're not trying to, sorry, go
Go
ahead.
ahead. I'm sorry. Go
No,
ahead.
so that's one thing we have done, but people are still apprehensive to know about themselves. And that's a human thing. And I'm not sure we haven't fixed that problem.
That's a human, that's the way we are as humans. We fear things we don't understand. One of the things you were discussing is the privacy and the reluctance. Some of the reluctance, especially for some elderly, is they don't want to have, if they've applied for insurance or something, they are diagnosed with, they know that they're going to get Alzheimer's or a form of dementia. They don't want that on their record. So I love the fact that because it increases your insurance and other things, people are their fear of paying more for insurance overcomes their sensibilities at making changes and lifestyle changes to delay the progression of the disease or even for it to occur.
Yeah, absolutely. And we learned that a little bit with Mayo Clinic as well. Mayo Clinic is very patient centric. It's just such a great learning. They're such a great partner. You have to look out from the perspective for the patient. And if that patient decides, I don't want to share my information, okay, but give her or him all the information. If that person feels uncomfortable sharing that with the physician or the payer, whoever it is, that's their decision. But please know about yourself first, right? We don't need to keep the data. We don't need to. And the good part is we're in an era where our cost of compute, and since we've already developed a lot of the models, is basically zero or close to zero. So our incremental cost is very little.
And in today's world where healthcare is out of control, that's a huge,
Yes.
absolutely huge.
Yes. Yes. And absolutely. If you, as you said at the very beginning of the podcast, I injured myself coming down Kilimanjaro. And what I didn't tell you in detail is I had a knee surgery at a hospital for special surgery in New York.
Uh-huh.
And I had a staph infection after that. So they
Ooh.
almost, yeah, so it was pretty bad. So they thought they're going to just, my left leg is going to be not there anymore. But
Yeah.
they somehow did a flap surgery. But as a result, here's the point. As a result, my left leg is about a centimeter, which is about half an inch shorter than my right leg.
Okay.
So if I don't do anything, I'll walk like that.
Uh-huh.
So I'm acutely aware of my posture, and
Yes.
I climb a lot. Even today, we bicycle a lot, but I can't run. I
Uh-huh.
cannot run for more than, I don't know, 300 feet. But so I'm super aware as an individual. And that's why I want other people who are in their either seniors or in their 40s or 50s, if they had injury, to be aware of themselves, what's going to happen when they age. And if they can take care of it earlier, which I do, I always use a knee brace when I go up the mountains. Always. I carry 2 knee braces in my car just in case.
Just in case.
Just in case. But that's prevention because I'm aware of my
Yes.
left knee. And that's all we're trying to do. And the best part is the tools are with you that you can check yourself. Are you recovering? Are you getting better? Are you getting worse? If you're getting better, great. And if you're not recovering, then you can come back and say, hey, what's happening? Why am I not recovering? But you know that yourself, your own conditions.
Exactly. One of your goals, Ash, is to help seniors age with peace of mind and control. So how can we shift the conversation from fear of aging to one of empowerment and preparedness?
Yeah, that's a very philosophical question, right? And we've been thinking about it. Yeah, it's a loaded question. I've been thinking about it for a while. For example, what happens to me 30 years from now, right? I think the first thing that, and I'm speaking for myself, the first thing that I would like to do is to be able to do what I'm doing right now for as long as I can,
Yes.
irrespective of the time making me chronologically older. And the earlier you find out what your issues might become later on in life, the easier for you to fix. The later you find out, it's harder, unfortunately.
Absolutely.
Yeah. So if you found out really late and we can help you diagnose, but unfortunately, we're not going to be able to do much. So our goal is to help you find out as early as you can. And age is just it's just a line and it goes up with time.
Absolutely.
But
Absolutely.
yeah, there's a 71-year-old in Japan. He just went up, this is 7 years ago. He went up Everest and came back. Mount Everest.
Wow.
Yes.
That's amazing.
Yeah, exactly.
Well, I know I've had many elderly patients. My grandmother lived to be 98. I call them the little sisters. They were my little great aunts. They were very tiny. They were like under 4'11". They were around to 4'11". And they all lived well into their 90s. And my uncle, my grandmother's brother, lived to 100. And so I have longevity in my family on one side, and that frightens me because my body's so broken at this point in time. And if I would have done things differently, maybe not worked in rehab nursing or whatever. But
Can I tell you something sci-fi? Here?
yes.
Can I tell you something sci-fi? Okay, most of your audience would know, but this would either freak them out or just get them excited. Okay.
Okay.
So a month ago, let's call it, they found a gene called FOXO3. And this was an experiment done in China on monkeys. And FOXO3, so they took the CRISPR, which is the gene editing software, and they overexpressed this gene called FOXO3 in monkeys, and then reintroduced it back into the stem cell in monkeys. And what happened is it created exosomes, meaning it created packages and went into tissues, brain tissue, heart tissue, your lungs, and so on. Everything was about 5 years younger.
Wow.
That means in terms of human, it's about 15 to 20 years younger. They haven't found cancer yet. With AI and artificial general intelligence not too far off, we may break the paradigm of living.
Wow. That's fascinating.
So it might freak you out or it might excite you.
No, I think that's awesome. People are living well beyond 100. I just had a client whose mother-in-law turned 104, and she's living alone in her home and has 8 hours of care in the morning. She does her social life, and she could live to be 110 or 120. Really, she doesn't have a lot of aches and pains, and I don't know what she did for a living, but she does have great genes, I'll tell you. She must,
Yep.
because to live that long, and she still has she's very good cognitively, and physically she's able to do things. I know you won't know who Jack LaLanne is, but my grandmother she worked out. Jack LaLanne was before Richard Simmons, and you may not even know who that is, but
I've seen Richard Simmons and some old footages. Yeah, yes. Yeah.
Jack LaLanne was the first on TV exercise program, and he did calisthenics and stuff. And that's why I learned to exercise, because my grandmother was so adamant about it. We got to watch Jack every day. And I did. I learned to exercise. And I think that's what helped her for so long. And my grandfather had a stroke. I can remember I was probably 7 or 8. And all of a sudden, we drank skim milk, not whole milk. We ate lots of veggies. We didn't use salt. Our lifestyle changed. And I think that attributes to why she lived so long as well. And so healthy.
Exercise is so key. Exercise and diet.
Yes.
So I eat 1 time a day, and I've been doing that for 4 years.
Wow.
Yeah, so it was difficult in the beginning, but I just wanted to see if I can train. My mind is sharper when I'm hungry.
Fascinating. Now,
because I'm like, my body wants to protect myself, right? Because I don't have any. So my mind is way sharper. It sounds weird.
Looking at that.
Yeah.
I do intermittent fasting, and I feel better because of it. I really do. And I'm very careful what I eat, but I eat fresh fruits, vegetables, because I have the ability to do that, which I'm grateful for. And it's just me, so I'm okay with that. But anyway, this has been fascinating. I want to ask you one more thing, Ash, before we go. What's the one message you want caregivers and families to take away from this conversation today?
Wow. I think the first thing is know yourself, know thyself, what's going on with your body. And if you think you want to do it privately, you can do that today.
Yeah.
But if you don't know, if you don't have the data on yourself, don't rely just on your intuition. Intuition might be a good starting point. For example, I'm forgetting things, leaving remotes in the fridge, but get the data. And today you can get the data for almost free, less than a cup of coffee, and in your privacy. And why not do that? And then make the decision. If you're great, it's great. But if you're not, then figure out what to do about it quickly. And it's in your hands. It's totally in your palm today.
Yeah. I'm totally curious about my health future. So when I'm off, I already downloaded your app, but I wanted to ask you a few questions before I did it. I'm going to do it. And if I'm able, I'm going to try to post up whatever's on the page we create with your program. And I'm definitely going to take it to the doctor the next time I see her.
Oh, absolutely. Absolutely, Diane. So our support team, our support team is going to send out an email to you.
Okay.
Because there's a system, they have to approve test credits at the back end. So they will approve enough test credits for you to do it, to show it to your friends or to the doctor. And somebody will send an email to you.
Awesome. To my family caregivers out there, I want you to know you are the most important part of the caregiving equation. Without you, it all falls apart. So please learn to be gentle with yourself. Practice self-care every day because you are worth it.